I often say that psychosynthesis psychotherapy, we're not shrinks. We don't shrink, we expand. We try to expand our consciousness. And this makes a real difference. Anyway, what is the core of psychosynthesis psychotherapy? Well, we hold together different approaches. Psychosynthesis has its roots in psychoanalysis. Of course, not only in psychoanalysis, but psychoanalysis plays an important role in psychosynthesis. And Assagioli, the founder of psychosynthesis, was the first Italian psychoanalyst. It was the hope of Freud and Jung for psychoanalysis in Italy. Well, they were disappointed because after a short period of time, Assagioli found his own way to psychosynthesis. For instance, a letter by Jung, Carl Gustav Jung, to Freud, and what Freud answers, because Jung asked Freud about psychosynthesis. He probably heard of psychosynthesis in Switzerland, in Burgölzli, the famous hospital, psychiatric hospital in Switzerland, where Assagioli was trained. And that was at Jung's days, when Jung was there, was working there. And probably the word psychosynthesis together with psychoanalysis, but psychosynthesis came to Jung's mind, and he wrote to Freud asking, what do you think about psychosynthesis? And Freud writes to Jung, I also shake my wise gray locks over the question of psychosynthesis and think, well, that is how the young folks are. They really enjoy things only when they need not drag us along with them, where without our short breath and weary legs, we cannot follow. That's very interesting because Freud is very clear about that. Freud was very grounded, as he writes in a letter to Binswanger, the famous existential psychiatrist. Freud writes, I stopped at the ground floor of the human building. And that's what he actually did. But Assagioli states very clearly that there is no psychosynthesis without a good, deep psychoanalysis. And this is often overlooked by some psychosynthesis psychotherapists. And psychosynthesis psychotherapists seen as a new age psychotherapy, peace and love, something very light that doesn't get deep into the unconscious, that it doesn't delve deep into the unconscious, which is not the case. It's not the case. That doesn't mean that psychosynthesis doesn't use other approaches, other techniques. We hold together different approaches and different techniques, even cognitive, behavioral, humanistic, existential, whatever fits to the therapeutic plan, as Assagioli used to say. We would rather say treatment plan, treatment planning, just specifically tailored to that specific person in that specific human condition. So this is very important not to forget. The roots of psychosynthesis are very complex. There's not only psychoanalysis, but you find spiritual traditions, you find the Jewish Kabbalah, and you find Hasidism, and the Eastern philosophies, and Plato, Plotinus, and Aristotle, and Hegel. You find his love for arts. You find Dante, the great poet. And Assagioli was a medical doctor, but he was also very humanistic oriented. He had a wide culture and was very interested in the human being and in the human phenomenon in so many ways. So it's not easy to be a psychosynthesis psychotherapy, because you also need to be a psychoanalyst in the first place, and then you need to be a cognitive behavioral therapist sometimes. You need to know some Gestalt or some other techniques, and we're very open. Psychosynthesis is very inclusive. No technique and no approach can be excluded if compatible with the needs of the person and the therapeutic relationship. If you would ask me, what is the core of psychosynthesis psychotherapy, I would say the therapeutic relationship and inner attitude of the therapist. That's the main thing, actually.